So if you take the antimycobacterial antibiotics, you should know that the Mycobacterium, it causes two important diseases. One is tuberculosis and the other one is leprosy, right? So if you take the Mycobacterium, this particular Mycobacterium, it causes tuberculosis, the other one is the leprosy. Now apart from this particular Mycobacterium causing tuberculosis and leprosy, there are several atypical mycobacteria, right? Even atypical mycobacteria may also cause infection in humans, especially in the immunocompromised patients, right? So apart from this, you see, like we have atypical mycobacteria. This particular atypical mycobacteria, it causes it causes infections in humans, especially in the immunocompromised patients. Right, especially in the immunocompromised patients. Now, first let me discuss about the anti-tubercular drugs, right? Now, this particular tuberculosis, it is caused by one of the mycobacterial species, that is what is called as Mycobacterium tuberculosis. So remember, tuberculosis is caused by Mycobacterial tuberculosis. The drugs against the Mycobacterium tuberculosis, we call them as the anti-tubercular drugs. These anti-tubercular drugs, like we have first line anti-tubercular drugs and as well as the second line anti-tubercular drugs. Now let me tell you which are all the first line and which are all you have as the second line anti-tubercular drugs. Now, so first let me take up the first line anti-tubercular drugs. So if you take the first line anti-tubercular drugs, we classify them again into the essential drugs and as well as the supplementary drugs, right? We classify them into, one is the essential drugs and next we have the supplementary drugs. Right, next what we have is the supplementary drugs. You take the essential drugs. The essential drugs, remember, they include Isoniazid, they include Rifampin, then we have Pyrazinamide and then Ethambutol. These are the essential drugs. Then you take the supplementary drugs. Supplementary drugs, they include streptomycin, then we have rifabutin and then we have what is called as rifampin. So these are the first line anti-tubercular drugs, the essential drugs and as well as the supplementary drugs. Next to this particular first line, let me tell you which are all the second line anti-tubercular drugs. The second line anti-tubercular drugs, remember, the drugs include thioacetazone, then we have para-aminosalicylic acid, then you have ethionamide, cycloserine, then we have kanamycin and capreomycin, and then we have amikacin. Apart from this, like we have certain quinolones which are second line anti-tubercular drugs, and those quinolones, they include the second line ofloxacin, levofloxacin and then moxifloxacin. So these are the quinolones, which are the second line anti-tubercular drugs. Then we have other second line anti-tubercular drugs that include linezolid, and then we have clarithromycin. So these are all your second line anti-tubercular drugs, okay, starting all the way from thioacetazone to the clarithromycin.